want to talk to you about why you wear those belly straps in labor and what we're watching for. I'm Abby, a certified lactation educator and a labor and delivery nurse. Normally I talk about all things breastfeeding on my page, but today we're going to do labor and delivery. When you're in labor, we put 2 monitors on your belly. One is to monitor the baby's heart rate, and the other one is to monitor your contractions. And to us as nurses, it looks like this. We call it a strip. Your baby's heart rate is here and your contractions are here. These can tell us how your baby's doing in utero. It can show us that your baby's doing well, and it can also show us your baby's not doing so well. So these strips are very, very important. We watch for things like accelerations. That's when baby's heart rate goes up like this. That's a very good sign that your baby's doing well. Then we also watch for things called decelerations, which is where your baby's heart rate dips. There are some good kinds of decelerations and there are some bad kinds. And as far as your contractions go, we want a good contraction pattern. The thing about these external monitors that we put on your belly is that they don't actually monitor how strong your contractions are, but we can tell the pattern that you're in. So our goal is to get your contractions to be about every 2 to 3 minutes apart. That's a good rhythm to get that baby moving downward. So say you're in labor and all of a sudden all of your nurses come running in the room and they want to put oxygen on you, they want to turn you from side to side, they want to give you extra IV fluids. They might have noticed something in that strip that said, baby needs to be moved around a little bit, baby doesn't look so good. And a lot of times those things can be fixed very, very quickly just by like moving you around, giving you extra fluids. And then there are other times where those things don't help and then you're looking at some other options. All that's to say is those strips are very complicated. I always encourage my patients not to try to watch it themselves because there's a lot of intricacies to it. And I also want to reassure you that there are eyes on that strip at all times. The entire time you are in labor, someone is looking at that strip. In fact, probably 5 different people are looking at that strip at any given moment. When we're taught to be labor and delivery nurses, that is the number one thing we learn. You do not take your eyes off that strip. Even if I go to the bathroom, I have to ask somebody to watch my strip for me. So rest assured, there's always somebody watching. A lot of people complain about having to wear those monitors. They are essential for us to be able to tell how you and your baby are doing during this process.